Autism doesn't always look obvious. In many toddlers, the early signs are subtle and easy to overlook. As parents, we often sense when something feels different, even before we fully understand what it is. In this video, I want to gently walk through 7 early signs of autism in toddlers so you can feel informed and not afraid. One early sign can be limited or inconsistent eye contact. You might notice your child doesn't consistently look at you when you call their name or avoids eye contact during interaction. For some autistic children, eye contact can feel uncomfortable or overwhelming, not because they don't care, but because it feels intense. Delayed speech is another common early sign. By around 18 to 24 months, many toddlers are using simple words and beginning to combine them. If a child isn't using words, gestures, or attempting to communicate consistently, it may be helpful to speak with a pediatrician about developmental milestones. Another sign can be not consistently responding to their name. Most toddlers begin turning toward their name by around 9 to 12 months of age. Even if they're busy playing, they usually glance up or look toward the person that's calling them. If a child frequently doesn't respond when their name is called, especially in quiet environments without distractions, it may be something to observe more closely. Joint attention is when a child shares focus with you, like pointing to something interesting or looking where you point. If a toddler rarely points, waves, or brings objects to show you, it may indicate differences in social communication development. Many autistic children experience sensory sensitivities. Certain sounds, lights, textures, or even clothing fabrics may feel extremely intense. A vacuum cleaner, a crowded room, or a scratchy tag in a shirt can feel overwhelming. If your child has strong reactions to everyday sensory experiences, it may be related to how their nervous system processes input. You might notice repetitive movements or focused play patterns. This could include lining up toys, spinning wheels repeatedly, or repeating the same movement over and over. These behaviors often help a child feel calm, organized, or regulated. While many toddlers repeat actions, intense or highly focused repetition, especially alongside other signs, may be worth noticing. Changes in routine can be especially challenging. Small transitions like stopping playtime, leaving the park, or switching activities may lead to strong emotional reactions. This isn't about defiance or being difficult. For many autistic children, sudden changes can feel unpredictable and stressful. Consistent routines and gentle warnings before transitions can help reduce anxiety. Seeing one of these signs does not automatically mean autism. Every child develops at their own pace, but if you consistently notice several of these signs, seeking early evaluation can provide clarity and support. As a parent, I've learned that early understanding can make a meaningful difference. Awareness isn't about labeling the child, it's about supporting them in the way they need. And different doesn't mean less, it simply means different.